In the name of God, most gracious, most merciful, welcome the speakers to this press conference of the National Medical Task Force for Combating Coronavirus COVID-19, His Excellency Dr. Walid Al Under Secretary of the Ministry of Health, Lieutenant Colonel Dr. Manaf Al-Qahtani, Infectious Disease Consultant at the BDF Hospital, and Dr. Jamil Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. And we would like to note that this press conference is going live on TV and on the YouTube channel of the Ministry of Health in 5 different languages. And we also have the journalists and reporters joining us remotely. Now, as usual, we begin with His Excellency Dr. Walid Al Under Secretary of the Ministry of Health. In the name of God, most gracious, most merciful, praise be to the Lord who has held everything within His knowledge. Praise be to Him for His countless blessings and grace. And praise be to the Prophet. We welcome you again to this press conference through which we aim at informing you the most recent updates, and we ensure you that all the paths and schedules are in line, and we confirm that everyone, while gradually going back to normal life, to fully commit to implementing all the precautionary measures and guidelines in order to maintain the levels that we achieved so far. And out of the achievements we have made so far and the booster dose, and in order to protect the society of the infection, we call upon all those eligible to register for the booster shot. And we note that the logo in Be Aware application has been changed to yellow color starting from the 3rd of October for those who are eligible to take the booster dose, as a reminder for them to take the booster dose, and it will automatically change into green once they take the booster dose. Those eligible can register for a booster shot by visiting the Ministry of Health's website on healthalert.gov.ph or through the Be Aware application by selecting the booster shot on the app. And we reiterate our warning of the false sense of security and to feel that everything is normal, and so people might get reluctant. So it is important for everyone to move on with determination by implementing all the precautionary measures and to take the initiative to take the vaccines in order to achieve the target goals. And to conclude, we say that through you, hand in hand, we're going to combat this virus and recover from it and protect the health and the health of everyone. Now I'll leave the floor to Lieutenant Colonel Dr. Manaf Al-Qahtani. Thank you very much, Dr. Walid Al In the name of God, most gracious, most merciful, good afternoon, everyone. My talk today, I'm going to talk about the booster shot. But I found it's important to introduce it to involve the society to highlight the efforts of the National Medical Task Force and specifically the use of the booster shot. So it's important to talk about the pandemic level locally and compare it internationally and see the levels of the spread of the virus. Thanks to the God and the wise leadership directives and the collaboration of everyone, we have managed to reduce the spread of the virus within our society. As everyone knows, globally, there are over 2,000 200,000 people who got the infection, and unfortunately 5 million who died because of the symptoms, and we still have people who are suffering from the COVID-19. So this virus, what we learned is that it is changing. It has a dynamic behavior. So we should have pre-steps. As Dr. Walid al-Mana, we should not feel the false sense of security until we have the full commitment of all the countries. There are some countries yet which we pray for to recover. So the National Medical Taskforce is that we use the tools for controls, and one of them is the booster dose, the booster shot. There are some misinformation about the booster shot. So today I'm going to introduce the booster shot, and I'll talk about the local studies and statistics that we implemented, and also I'm going to talk about the mechanism of the booster shot on those eligible, because it's really important in order to involve the society in reducing the spread of this virus. Well, the booster shot is an additional shot in order to enhance the immunity of the body and to continue having the immunity throughout the body. So it's important to fill the gaps for those people who don't have a full immunity, especially for those who took the 2 doses. The importance of the dose. Let me talk about the local studies which was covered from the 1st of July up to the 1st of October. Out of those who were infected with COVID-19, 52% were among those who did not take a booster shot, and only 3% were among those who received the booster shot. And thank God, they were those who did not experience symptoms and their status was stable. And this is a great proof that the booster shot is really important to create protection in the body. Well, what about the mechanism? There is still some misinformation. We have the mechanism for those eligible. We have people who have completed the 2 doses, and also those who were recovered. They have their own mechanism. So let's start with those who took the vaccine. The eligible shot was available for those 18 years old and above who completed 6 months after the 2nd dose for Pfizer, Shield, which is AstraZeneca, or Sputnik. Those people can take this booster shot, either the same vaccine of the 2 doses or what we call Pfizer. Also, the period of taking the vaccine for those 18 years old and 39 years old who took Sinopharm was reduced. It was 6 months and now it is 3 months since the 2nd dose, and either can be Sinopharm or Pfizer as a booster shot. Also, I note that what has been announced of having the booster shot available for those 40 years old, which are the mostly exposed to the COVID-19, and those with obesity, they can take the booster shot after 1 month of taking the 2nd dose, either the same vaccine or the Pfizer. And all of these mechanisms were based on local statistics after proving the security and safety of these vaccines. As for the mechanism for the recovered, there are some people who were recovered and took only one dose. And this is based on statistics that proved that one shot was enough, but now, due to having variants and the weak immunity after a period of time, it turned out that it's important for those recovered can take the second shot for Pfizer based on the local and international studies. And for those who completed 2 shots and they were recovered, the studies showed that they have immunity for a long period of time. So according to the national statistics, it could reach up to 12 months. So for those who completed 2 doses and were recovered, they can take, or they are recommended to take the booster shot after 12 months of having the infection. And to conclude, if you allow me, I would like to express my sincere and deep thanks to the media, because we have to say, while having the virus, there is so many misinformation that we experienced about COVID-19 and about the misinformation about the vaccines, and we're still having the same misinformation about the booster shot. So I think the media has fought by all means to answer all the inquiries, because there is difference between misinformation and inquiries. So thank you, the media, for answering those inquiries and for highlighting all the protocols in a very simple manner. So thank you very much, because you are the means to reach the normal life. So thank you very much from the National Medical Taskforce. Now I'll leave the floor to Dr. Jamil Salman. Thank you very much, Dr. Manaf Al-Qahtani. In the name of God, most gracious, most merciful, peace be upon you. We meet with you again in this press conference. Today, I'm going to talk about the updates of the national campaign, especially for kids. Let me confirm that the results we have achieved so far require us to continue with the same determination and the same initiative to take the booster dose, because according to the statistics locally and internationally, that these booster shots are safe. Thank God, we still have the category of 13 years old are coming to take the vaccine for the Sinopharm. And we also have achieved success for those 12 to 17 years old to take either Sinopharm or Pfizer for this category. And we call upon parents to take the initiative to register their kids to take the vaccines. And we thank those who have already registered. This proves that they are aware of the importance of this vaccine, because it's going to reduce the infection and create immunity for their kids. And I confirm that it's important to take the booster shot because it has important results, especially for the past months, by increasing immunity and creating antibodies to fight the COVID-19, even by reducing the symptoms and the severity of these symptoms, and God forbid to go into ICU. And we confirm the importance of following all the precautionary guidelines and instructions issued by schools, educational institutions, in order to protect the health and safety of everyone. And we pray the health and safety for everyone, and by the collaboration of everyone, we're going to achieve more progress. Thank you very much. Thank you very much, the speakers. Now let's have the questions from the journalists and reporters who are joining us remotely. Question to Dr. Walid Al-Mani from Sayyid Ali Al-Muhafadha, Al-Bilad newspaper. With the reduction of the active cases and the initiative to take the vaccines and having the safe level, when do we expect to have the full back to normal life and to remove the wear masks inside and gatherings? Thank you very much. I think everyone is thinking about that. Hopefully we can go back. Well, over the past period, the National Medical Taskforce, one of the targets is to assess the situation in the Kingdom of Bahrain and to have this assessment in line with the measures or actions that would not, stop people from practicing and exercising their normal life and at the same time maintaining their health. Thank God, Bahrain, as we can see and look at the statistics, are going down. And even those going into hospitals were reduced. So also, we talked today about the precautioners, the false sense of security. Yes, we do have security, but not to the extent that it will make people reluctant in implementing the precautionary measures. So about wearing masks, do we need them? Yes, we need them now. It has proved its efficiency over the past period of time, and we still wear it in the closed areas. And I think we will need over the coming period of time to maintain what we have achieved so far. So when are we going to go back to our normal life? I can't give a specific date, but hopefully soon, because the numbers are stable, and by going down, it means maybe the National Medical Task Force could decide, and the traffic light system could have, a deeper look and consideration. And we have, thank God, we're still almost practicing our normal life, and this is a bless by the commitment of everyone and the collaboration of everyone and the care of the wise leadership. So hopefully we're going back to normal life, but it's important people continue to implement as before. Thank you very much. Question from Huda Abdul Hamid to from Al-Watan newspaper to Dr. Manaf Al-Qahtani. Is there any contradiction between the vaccine for the flu, the vaccine for the seasonal flu, and for the COVID-19 vaccine? Thank you for the question. Let me clarify that COVID-19 is totally different than the flu vaccine. So people should differentiate between them. Secondly, the flu influenza was before the COVID-19, and we were suffering from as experts by looking at people coming with complications with the flu. And it was seasonal, starts from now, and I think there is an increase in the number of those who have the seasonal flu. The question, which is more important, do the flu vaccine would weaken the immunity? This is false. No, the vaccine will never weaken the immunity of the body. In fact, it's going to enhance it. And I hope those people should not spread those misinformation. The immunity of the body, the normal one, would be enough. No. I think the past years proved to us those who have chronic diseases, especially the pregnant women, will have complications as a result of the flu. So there is no contradiction between taking the vaccine for COVID-19 and for the flu. Maybe at the beginning of the COVID-19, there were no sufficient information and statistics, so we left like 1 week to 2 weeks between the vaccines. But now, while having sufficient information and various studies, one of them is the British study and the recommendations of the World Health Organization and the American institution, all of them proved that taking the vaccines together on the same day has no health problems. And it's important that the monitoring body should follow up on the symptoms and people should report them. So just to brief, there is no contradiction. We recommend to take them, and you don't need to leave days between the two vaccines, and it's safe to take them both the same day. Thank you very much. Question from Fatima Ali, Al-Akhbar newspaper, to Dr. Jamila Salman. We are about to experience the seasonal flu, and which is going to be harsh and harsher than the previous years. Is it true that the immunity of people is getting lower after COVID-19, and how the National Medical Taskforce will face this and maintain the health in general? Thank you for the question. It's important. We're about to experience the season of flu, and it's going to cause issues. So after COVID-19, has the immunity of people reduced after COVID-19? It has nothing to do with, with this. So in fact, what happens, if there is a pandemic with a new virus, it will change the lines and the ways of spreading of those virus, and it could have the same similar symptoms. So it will replace it because it's the mostly spread virus like COVID-19. So if we have processes in terms of like having at the same time of COVID-19, like taking precautionary measures, taking the vaccines, they will stop the virus from spreading in society, as we see in Bahrain. So now, as we can see in Bahrain, we see the previous viruses like flu or similar will be there. Will this season be like worse? It depends on the flu itself, number one. Number two, because the flu, it changes yearly, and we have special vaccine. So we are required to take this flu vaccine on a yearly basis, whether we have COVID-19 or not. Is it going to be worse? It depends, because we have COVID-19 now. And, as we said, having COVID-19 in line with it. So in epidemiology, if we have one virus is different than having two viruses at the same time. So maybe complications will be more, and maybe ICE will lead ICU. The second part of the question, how can we fight it or maintain the health in Bahrain? What we learned from COVID-19, basically, that we now know how to protect our immunity, our health, by taking the healthy food, exercising, washing our hands, wearing masks. Those will help in reducing the infection of COVID-19 and flu and any other similar viruses. And since we're about to experience the flu season, it's important to take the flu vaccine and the booster shot and take the accurate information from the right sources like the Ministry of Health of any disease and how to take the booster shots. I'll stay with you, Dr. Jamila, from Raji, GDM, to Dr. Jamila Salman. Is the Kingdom of Bahrain studying having new medicines for COVID-19? And are there any updates on any new medicines? Well, as we mentioned at the beginning of the pandemic, the treatment protocol is updated according to the studies. If the medicine has proven to be efficient and we have the proofs, it will be included. And as usual, these medicines will be based on the results, that the efficiency rate and the purpose of it. And as mentioned by the journalist, maybe over the past 2 weeks, there is like a new medicine, we're taking it as pills, and this would reduce the virus and the spread of the virus within the body. And some of the studies proved that by 50%. Well, we are still waiting for more information until we get the results of the studies, until like reaching the third trials. And if it's proven to be efficient and included within the treatment protocols, we're going to have it within the Bahrain protocol. Hopefully. Thank you very much, the speakers. We now conclude the question and answer section. Thank you very much for listening and watching. And also thank you for the journalists and reporters. Before concluding, kindly be reminded to follow all the precautionary measures and guidelines to mitigate the spread of COVID-19 and combat it. Thank you very much.